Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at thedove.us.
Well, welcome back to Focus today, and we are talking about, I'm going to say, what we all think we know about as far as long-term care is concerned, but maybe we need to know a little bit more about kind of the back-end story that we're not familiar with. My guest is Gail Armistead. It's great to have you with us. You're a certified ombudsman with long-term care. Now, it sounds to me like you are the nursing home police. Is that anywhere close to being accurate? Because you're kind of checking to make sure that people who are in some sort of housing situation aren't misused and abused and all that. Am I right on that?
You know, that's true to a certain extent. But our main function is to visit the long-term care facilities, nursing homes, assisted living, residential care, memory care, and adult foster care homes, to actually visit with the residents to see what their complaints are, what their issues are, how we can help them in any way. It's all confidential. Any interaction we have with the residents is confidential. Most of the problems that we solve are easily solved. It can be food, it can be a care planning issue, but they have the right to be confidential with us. Now, the only exception is that you used a little bit of that term, the policing of, because we do educate the facility along with the residents. But one of the things that we are obligated to do if the resident tells us something that we suspect is either physical, emotional, or financial abuse, then we do have the obligation by the state to go ahead and report that to Adult Protective Services. But for the most part, it's a matter of just advocating for that resident and resolving the issues that they may have. Some of them are just small things that are easily resolved, and then there are other ones that take a little bit longer with investigation and getting other people involved.
You know, I think we've known that especially Southern Oregon is a place where a lot of people are retiring to.
Yes.
Are you still seeing that trend, are you?
Yes. We absolutely are.
And so we're probably seeing more of those kinds of facilities for those individuals. Is that also growing from what you've seen?
It is. Right here in Jackson County, which is my main focus right this minute, because we only have 6 ombudsmen here. We have 5 nursing home facilities, skilled nursing, approximately 25 assisted living. The growing part of this business is memory care with Alzheimer's and stroke dementia and that type of thing, which is a huge issue as you grow older right this minute. And then we have 135 foster care homes.
Wow, really? Just in Southern Oregon? How about
just
that?
in Jackson County.
Wow.
And so when you have 6 ombudsmen, guess what? That's a lot of beds to cover, and we don't see the residents as often as we should. So, you know, my prayer is that somebody that hears me today who has a heart for the elderly in their care, that they would just pray about looking at the possibilities of becoming a long-term volunteer. So
obviously then you need more, right?
Yes, we actually need approximately 10 more here in Jackson County alone. Just to
kind of be able to meet the schedule you have to cover it? Yeah.
Yes, and you know, it's one of the wonderful things about this volunteer program. It's a flexible schedule. We're only required to be 16 hours a month, which is about 4 hours a week, and that includes the visiting, and it includes the reporting, and it includes the travel, and it's flexible. So if you're going on vacation for 2 weeks, that doesn't, you can go ahead and do that. And if you're a morning person, you can visit in the morning, and it's usually daytime schedule, so it's very flexible according to what works for you as a volunteer.
So are you a volunteer with the state agency?
Yes.
Is that how that works out?
Yes, okay. I'm a volunteer with the state as an advocate for residents who are in the nursing homes, assisted living, and foster care, memory care.
Okay.
I have 4 assisted living, 1 memory care unit, and 12 foster care homes that I visit every month.
I see. So they don't, they centralize you in specific
They give me
places,
specific, and one of the reasons they do that is because they try and make it convenient for you. If you're a Medford resident, those facilities in your area. I happen to live in Eagle Point, so I have to come in, but it's a really wonderful, wonderful program. And I find that most of the volunteers have had some experience with the elderly, whether it's their parents or some other loved one. So they know the issues when you're in a long-term care facility. And some of them have advocates, some of them don't. One of the things that I always do is I'm visiting the residents and knocking on doors to see if they have any complaints. And it can be complaints not only about the facility, it can be care planning, it can be family issues.
Okay.
I mean, we deal lots of times with residents with their family issues because so many times daughters and sons feel like they need to take care of their mothers, and they take their decision making and their rights away from them. And we're very concerned about residents' rights and what they have the right to do when they're not just because they're in these long-term care facilities.
Let me ask you about the trends that you're seeing. You know, we used to call them nursing homes, and then that wasn't really accurate because they weren't just for, you know, nursing of patients. They were actually long-term facilities that were now retirement centers and all of that. How different are the options for people now than they were, let's say, 20 years ago?
Okay, so 20 years ago, it was probably all skilled nursing home type things.
All right.
Today, the assisted living and residential care, they're in there for many reasons. Sometimes it's just a matter of the only thing that an elderly resident needs is medication help, so that they're taking their medications properly. Some of them do need help with dressing and getting that type of thing in the morning. So there's different aspects, but I think that the assisted living, where you're in an independent apartment and you feel like you're not confined restricted to just a nursing home where somebody's taking care of you 100%. You have some of your own care. The other thing that is growing right this minute is the memory care units.
Yeah, I was interested when you mentioned that. There are memory care units, huh?
Yes.
So for people who have Alzheimer's and special needs to make sure they don't wander out.
Yes, they're usually locked facilities.
Okay.
Yes,
sure.
and that part is growing. As a matter of fact, I was just talking with a marketing gal at the Manor the other day, and they have a beautiful facility up there. They also have assisted living and residential care, but they have a memory unit with 25 elderly people in there right this minute, and they see the need for expanding there too. So they're looking into that.
Now, I realize this may be outside of your expertise, but with that, since we're seeing the need being filled for that, was it that people always had that problem but we really didn't fill that particular need for them? Or is it that everyone's getting older and we're living longer and so this kind of shows up?
I think it's both.
Oh, okay. Because, you know, I'm thinking that facilities and the nursing homes, they kept an eye on people, but they didn't have a facility just for people with Alzheimer's.
And I think that nowadays they can have some specific diagnoses. Obviously with Alzheimer's, until you're actually dead and you can do an autopsy to look at the brain, but they have different characteristics with Alzheimer's versus Lewy body versus alcohol dementia versus stroke dementia, all of which can lead to that type of memory care needs. So I think that they're getting much more expertise as far as the medical field is concerned. So we can pretty much determine that and see what the best need is for the elderly.
Well, let's talk a little bit more about what's involved if somebody wants to be a long-term care ombudsman. What kind of training do they go through?
You know what, it's extensive. First of all, we start out, if you're interested in volunteering, I can actually give you the website and an 800 number to call, and they'll send you a packet. But then we go through an interviewing process, which is part of my job now, not only as a long-term care ombudsman, but as a screening person and an interviewing person. So you'll go through an interviewing process, and we're looking for people that have good communication skills, good problem-solving skills, because that's what you're doing when you're advocating, is resolving some of the problems. So that's the first thing. And then you'll have to go through a background check.
Sure.
And also, so there's no conflict of interest, so we're interested that there's nothing that you do on the outside that would be conflictive. And then we put you through an extensive state program. And there is one coming up here in April for Jackson County and Josephine County. And it's, I think it's the 7th, 8th, 14th, 15th, and 16th. And it's pretty intensive. and you're not expected to learn everything all at once, because we then have mentors. So before you're even assigned facilities, you work with those of us that have had some experience, and this is I'm going into my 5th year. So I take people around and show them the different facilities and show them how we work and what's the best way. So they're not left on their own at all.
Yeah.
And then you have to pass a test, but it's an open book test, and it's things that you've been through for those 5 or 6 days. So
you know, you hit on something earlier that I was thinking. I suppose you have to be an individual with a little bit of intuitive sense to be able to understand what a patient might be saying and what they really mean as well, because it could just, you know, what they're saying, there may be far more to what's involved that they just don't feel comfortable talking about, but you have to probe into that to find out more, right?
Yes, you absolutely do. And that's when your investigative skills come in.
Well, how can people get in touch with you? What's the best way? There's a website, right?
Okay, there is a website, and you can go to www.oregon.gov/LTCO.
Okay.
There's also an 800 number, which is right out of Salem, 800-522-2602.
Okay.
And you can tell them that you're interested in finding out about the program, and they'll send you a whole packet.
Okay.
And if you're interested in...
I'll tell you what, we're running out of time, but I'll tell you what, Gail, if people want to call and they need that number, they can call us now. Thanks for being with us.